found myself trying to figure out, like, is this simply a result of rapid weight loss? Because we know this happens with rapid weight loss independent of what was the mechanism behind the rapid weight loss. Or is there something else happening with the medication? So GLP-1 induced rapid weight loss, is that?
There's a process. If you lose like a pound of weight, your skin is slowly releasing collagenases and working on all of these different components to adjust to that smaller size. And when you try to outdo that system, the skin is like, dude, I can't break myself down enough to contract and sit tightly on this body.
How does one know when they're getting loose skin that it's sort of surgery time, I guess, because thank God that people like you are there to help them. But of course, everybody wants to prevent this, right?
The skin, as you know, is a very complex organ. And as a burn reconstructive surgeon, when a patient gets burned, we have to excise all that skin that's burned. We have to produce skin for them. And it's whether it's from their own body or we take samples and send it off to a company that helps build skin. Now, why is that important? Because skin is the...
All right. Welcome everybody to the Lasting Weight Loss Podcast. And I'm super excited for our guest today. Benson is a double board certified plastic surgeon and reconstructive. And I want you to just, let's dive right in. I know I didn't even get your accolades right here. So why don't we start with you telling us exactly, I know you have a wealth of knowledge. I've checked you out after you reached out and I was very, very impressed with what you're doing. So yeah, why don't we start with a little bit of kind of, your background, exactly what you are, your accomplishments, and then we'll go deeper dive from there.
First off, Dean, I really want to thank you, man. I'm equally impressed. I follow you on Instagram. I'm a little bit of a fanboy. I'm impressed with the stuff you're doing, and the knowledge you're relaying is really helping me out too. So thank you, and I'm honored to be on.
Awesome,
So
thank you.
yeah, absolutely. So I'm a guy who grew up in New York, spent my formative years in New York City. And was really just influenced by art, music, sports, creativity. Fortunately, I went to a really cool high school, Regis High School, and I got into med school right out of high school. So I didn't have to take the MCAT, but what I did was the requirements were 4 years of college at Siena College, and then you would do 4 years at Albany Medical College. And college was amazing. I played college football there. I had a lot of really good friends and really learned a lot about other people and myself. And then med school came, and med school, it was tough. It was a beatdown because you have to realize everybody there is smart. Everybody's the top of the class, and everybody's studying all day long. And so in med school, off record, I was kind of describing to you, it's really hard to know what kind of doctor you're going to be. I got influenced by a nephrologist once who just bought me a coffee and talked to me about dialysis and this, and I was like, oh, this is pretty cool. And so I followed him around, and it just didn't really resonate with me. And then I rotated with orthopedic surgery, and I was working out, and it just felt cool. But again, I felt like for me, the surgeries were interesting, but I didn't see myself as a surgeon. I thought of surgeons as being mean and they walk in the halls and not say hi. And I just kind of had a little bit of a softer touch, I thought. And, I did general surgery rotation, and that's where I rotated on transplant surgery. And that was a really pivotal moment in my life because I got to see what the marriage of research and clinical expertise can do. So immunology plus really good transplant surgeons, and you're saving lives. And it was unbelievable. At that point, I decided I wanted to do general surgery because general surgery encompasses all of these various aspects of surgery. So you can do transplant, you can do vascular, you can do really whatever you want. And so
So at that point, you weren't specialized yet. You just kind of knew general surgery.
Yeah, general surgery. So I went to a program called, and I still call it UMD&J. It's in Newark, New Jersey. Very proud of it. It's a blue collar program, ridiculously good training. And on day two, I was asked by my co-intern to just come in and check out a cool hand case, and I did. And it was like nothing I'd ever seen before, working on the hand and just not having a formula for surgery, really being creative and figuring things out. And so from that point on, I always had this itch for plastic reconstructive surgery, but I also really liked blood vessels and vascular surgery. So at the end of my second year, I really wanted to make myself competitive, and so I decided to do 2 years of research at University of Pittsburgh Medical Center in face and hand transplant surgery under Dr. Andy Lee, and that was life changing. That's where,
Wow.
again, two aspects I learned a lot about myself, about discipline, but also the field of plastic surgery, because the field of plastic surgery to me, I thought was just aesthetic surgery and superficial. But here at Pittsburgh, I was watching residents do what are called free flaps, taking tissue from one part of the body and transplanting to another, sewing blood vessels together, and doing hand surgery and I just was like in awe of this. And so I finished my 2 years. They were very productive. I went back and applied for plastic surgery. Unfortunately, I got my number one, which at the time and several years is the number one plastic surgery reconstructive program in the country, UT Southwestern in Dallas. And that was a
Wow.
really amazing, challenging, transformative time for me because I walked in thinking that, I knew everything, did general surgery for 7 years, knew how to save lives. But on day one, you know, the training was such that everything was so scrutinized and everything was so looked at in a microscopic way, which was amazing for me because I really got to understand that technical expertise in surgery is really what matters. You got to have the brains, but you got to make sure your hands are where it's at. And so I really focused on becoming a very competent and conscientious as well as efficient surgeon. And that took a lot of practice, man. I was taking gummy worms, cutting them in half, putting them on a cork board, sewing them as tendons, taking teddy bears home, sewing them up, taking extra vein from vascular cases. My wife and I, who's also a plastic reconstructive surgeon, we made microscopes out of the innards of like quicker boundary picker uppers, that little tube. And what ended up happening is we got our reps, and I then decided it was really important for me to understand one another aspect of plastic surgery. And I really liked hand, but I also wanted to understand hand to be marketable too. I wanted to have a niche, and so I did a hand and microsurgery fellowship, and uh, that was also transformative at Pittsburgh. After that, fortunately, my wife and I were offered a position, myself as the director of the Burn and Reconstructive Center at Swedish, and we started this burn unit here, which is verified right now, which is a term called which is based on the American Burn Association. It's a verification status, which we're really proud of because it feels like a mom and pop shop, but it's nationally known for the care that we
Known.
provide. And what we decided was we were doing these high level reconstructions and still are. I mean, my wife is actually upstairs. This is our office doing some kind of reconstruction, finishing up her day. But what we realized was that even though we were reconstructive surgeons, we had this desire for aesthetics, even in our own reconstructions. And so when we do take care of burn patients or take care of a hand, we think about where the incision is. We think about how we want this patient to look. Because at the end of the day, even though we do a huge surgery, all they're going to see is the incision and see the scars that ultimately will remind them of that trauma or that surgery or a cancer. And so it's our job to mitigate that. And so all of us decided we wanted to open up an aesthetic surgery center as well. And so we created La Vie, which means life in French, in Lone Tree, Colorado. And it's a pure cash pay private practice, just like you would think. I mean, we do facelifts and eyelids and breast dogs and tummy tucks and liposuction, massive weight loss surgery. We do body contour. We do all of that stuff. And I personally am really into body contouring and really into mommy makeovers and that kind of stuff in our private practice because for me, I feel like we've been doing that stuff from the inside out for 10 years in reconstruction. We know the anatomy, we know the nerves, we know the blood vessels. Why not work from the outside in? And so we're in the
Right.
space now where we're getting busy. It's still in its embryonic phase, but it's exciting. I'm sure, as you know, as an entrepreneur, um, every additional person that comes on, you're honored to have them. Every patient that comes into your office and signs up for surgery, even if it's reconstruction or if it's aesthetic, that's a privilege. That's something
Right.
that, somebody's giving you their body basically and trusting you. And so we take that seriously. And I really, I treat my patients and I tell them like my family. So when they ask me, what would you do? I say, if you were my sister, my brother, my mom or dad, this is what I do. And it's true. That's what I would do. And it gives them a lot of relief, a lot of solace, and then they can kind of move forward knowing that, surgery is unpredictable. Complications happen. But ultimately, we're a team. It's not just, one sided.
That's awesome. That's awesome.
Yeah.
Um, Currently, would you say it's a pretty even mix right now between, body contouring, plastic side of things versus your hand reconstruction?
Yeah, I mean, I think right now the way we've scheduled it is we each cover our hospital for a week, and then for those other remaining 3 weeks, we're doing a combination of reconstruction and aesthetic surgery. So when you're on at Swedish, you're busy, you have a lot going on, and so you typically will go to the private practice for a day or two. But when you're not, you have a lot more freedom and a lot more leeway to really do that. And so we're still figuring things out, but at the end of the day, it's I'm just so impressed that, all four of us have come together. I didn't grow up with a lot of money. My family, we didn't have that. We were first generation. My parents emigrated here from India in 1977. And my dad is just so proud because my older sister, she's a pediatrician. Her
Wow.
husband's a pediatrician. They have a practice. And my younger sister, she's a PM&R doctor, and her husband's an engineer. So when we get together, there's a lot of a lot of a
So
lot
mom
of
and dad produced a whole family of physicians without even being physicians themselves. That's pretty
no, and
impressive.
and and it wasn't even promoted, to be honest. My dad really liked computers. We growing up, he had motherboards downstairs, and I felt like he wanted us to get into that. We couldn't have static electricity in downstairs because you'd cause some kind of
Oh,
shortage. But yeah, I mean, it just worked out that way. And I know, a lot of the stuff that I do, and especially as I'm older, is really still to make them proud. I want them to know that their big sacrifice in coming to America wasn't wasted. Their kids are not only successful, but they're producing and helping other people in this country that they were so scared and nervous of entering and had nothing upon their arrival.
yeah, I mean, it definitely says a lot about your character, and anybody getting any sort of healthcare business, whether it's as extensive and involved as what you're doing, down to general primary care, down to holistic. I mean, anything. I think in this country, with the current state of affairs in the healthcare system, it's tough to do. Like, this is not. I tell people all the time, like, healthcare is not the place to make money when you look at the ratio of risk and liability and stress. Yes, you can make good money, and I think people should be rewarded for their good work. But I think there has to be, and there almost always is, like you've shared, this warm place in their heart of, we're choosing this path because we want to help people, right? At the end of the day,
Absolutely.
yeah, I respect and love that whole story and what you're doing. Um,
Thank you.
let's dive into, let's dive into weight loss, and I get this question asked a lot with loose skin. So
Hmm.
let's just talk loose skin as a general concept, and then we can kind of take it down that path towards eventually when surgery is going to be needed.
Absolutely. So, I mean, the skin is, as you know, is a very complex organ. And as a burn reconstructive surgeon, when a patient gets burned and we have to excise all that skin that's burned, we have to produce skin for them. And it's whether it's from their own body or we take samples and send it off to a company that helps build skin. Now, why is that important? Because Skin is the barrier to the outside. It prevents infection. It provides the ability to thermoregulate. It allows for properties that keep us safe. But at the same time, that's the reconstructive part about it, but it's also aesthetic, right? And
Yeah.
so, as you know, and the world knows, we have medications now that are allowing for rapid weight loss. And
Oh
what
yeah.
we're seeing, yeah, what we're seeing now is a dramatic increase, especially we're seeing it in our practice in patients that have loose skin. Now, when you do like histologic, just examination of the skin, what you see is there's an epidermis, there's a dermis, and then underneath that there's the hypodermis and subcutaneous tissue and fat. Subcutaneous tissue and muscle.
So
And so over time, what happens is there are changes really in both the epidermis, but more prominently in the dermis. And that's what causes a lot of the loss of elasticity, the collagen changes, the elastin changes. And so you lose some of that elastic ability. Like if you take an infant and you pull on their skin, it immediately retracts back. But if you go on a 90-year-old, sometimes that skin will pile up. And what we're seeing now is that loss of subcutaneous fat, whether it's on the body or the face, is allowing for a lot of this loose skin to be more prevalent. Um, and it's a good thing and it's a bad thing. It's a good thing because what these medications are doing is they're transforming lives, they're causing people to live longer, they're saving lives, patients that are uh, diabetics, that are morbidly obese, that are on the brink of getting a stroke or a heart attack, or what other ailments can come from having excess weight, are now able to get a second lease on life. In Colorado, we see people hiking, they're doing 14ers, they're visiting their families because they're less embarrassed. Um, and so I think that at the end of the day, as we age, there's intrinsic changes that happen in the skin, like the interface between the dermis and the epidermis changes. The thickness of these layers change. Um, we have, aside from that, we have external things that happen. We're in Colorado. The sun is just beating on us. We get UV
right.
damage. If you're a smoker, smoking is one of the unfortunately worst things you can do for your skin and your health. Causes just hardening of vessels. It causes skin changes. Um, I think there's, aside from that, as an external kind of internal cause, I think is some of these medications that we're prescribing to help people with their obesity and their excess BMI. And it's allowing for patients to really have this second lease, like I said before. But now there's a new problem of excess skin, and now people are embarrassed. They're wearing compressive clothing. They're getting kind of infections underneath. The skin is hindering them. So it's a functional and aesthetic problem, I think.
Yeah. Yeah, no, we're seeing so much of that. People come to us for more of the holistic approach towards using these
Hmm.
medications. I'm fortunate enough to have really, jumped in headfirst with the utilization of these, and but keeping it still with the goal of like, hey, let's use this as a tool and get you off. So, yeah, we're getting a lot of people that come to us, and so we're certainly seeing a lot of that, like you said, and I've uh, found myself trying to figure out like, is this simply a result of rapid weight loss? Because we know this happens with rapid weight loss, independent of what was the mechanism behind the rapid weight loss. But, or is there something else happening with the medication? So
Hmm.
GLP-1 induced rapid weight loss, is that, causing a particular faster degradation of the skin elasticity? And obviously, we don't have data on that, right? So I'm speculating. Do you have any opinion on that? Like,
You know,
from what you're seeing?
so there's definitely truth to rapid weight loss. So what happens when you lose weight quickly? The subcutaneous fat, there's two different types of fat, really. That there's the dangerous visceral fat that's on the inside, underneath the abdominal muscles, inside your body, around the organs, around the blood vessels, and this type of fat secretes hormones that can be pretty detrimental to your health. And so part of it is, and that's the term skinny fat, where you see people that are kind of barrel chested and barrel abdomen, but they don't really have a lot of subcutaneous fat. And so that is a different beast. And so when you do things like sprinting, for example, or high intensity exercise, that works on that. Now, the layer above it is the subcutaneous fat. It doesn't produce these dangerous hormones in such a capacity as the intra-abdominal fat, but this is the stuff that we see externally. And when you rapidly lose this layer, the skin can't adjust. So skin typically, there's a process. If you lose like a pound a week, your skin is slowly releasing collagenases and working on all of these different components to adjust to that smaller size. And when you try to outdo that system, the skin is like, dude, I can't break myself down enough to contract and
It's
sit
enough.
tightly on this body. So that's why you see sometimes people, and I'll see them every now and then, that have lost like 70 pounds and have no stretch marks, have had no excess skin.
Yeah,
And
just
when I
complete, just everything looks great. And
ripped,
then someone else
ripped.
is completely gone.
Yeah, and I ask them, and they'll tell me they lost weight over 4 years, and versus other people that have lost weight in 6 months, and that skin, once it loses that, once you lose that much weight, I believe it loses the capacity to recoil, and so that's when you get into the surgical realm. But I mean, you raise an interesting point. These medications is there a secondary effect happening? And we know there's definite effects that are coming out with the medications on addiction, right? Like smoking and drugs and food addictions, things like that. It's working on the brain in that matter. So why couldn't it work on different pathways and downstream regulators in a similar fashion for skin and skin elasticity?
Yeah, there's certainly so much in front of us that we have to learn about these
Yeah.
medications, and I'm just fascinated by their use, and
Hmm.
definitely, like you said, it's almost all good in front of us with these meds, and so I'm certainly a fan in how we use them, but. So looking at this process, we from what you've said, we have the normal age related degradation and loss of normal elasticity. You have these existing lifestyle choices like smoking, inflammatory things. General health is obviously going to contribute to that rate, and then we have rapid weight loss, which, if I understood you correctly, you're looking at this and saying the you'll have more elastic potential if you go slow enough, and there seems to be some
That's right.
threshold,
That's
versus
right.
if you go on the other side of it, it's like, yeah, like it loses its ability. That's interesting. I never thought about it like that. I never thought about it like that. And yeah, so I mean that makes sense why with these
Yeah.
medications. I mean, I couldn't tell you how crazy it is right now. The because I coach probably 8 new patients a day in our program. I would say 5 to 8, and so we jump on those Zooms, and I'm talking to a lot of them now, and it seems over the last 6 to 12 months, more and more people that I'm getting that this is not their first time on GLPs. Now I'm getting a lot more. I've been on them for a while, and I saw your
Hmm.
videos versus a year and a half ago. I'm just starting for the first time.
Nobody. Yeah, yeah.
Yeah, exactly. And so they're coming to me now, and they're talking to me about what the guidance they're getting from their obesity specialist, and how there's just unfortunately a lack of understanding of the intricacies of the metabolism, and how
Hmm.
much people are barely eating on these things, and that's my other big thing is like that it's
That's right.
producing. That's a little bit of the dark side, and
Yeah.
I'd love to chat with you about that certainly on another episode. But uh yeah, getting back to this concept of when surgery is needed. So how does one know when they're getting loose skin that it's sort of surgery time, I guess, because thank God that people like you are there to help them, but of course everybody wants to prevent this, right?
Absolutely. Yeah. A lot of people who are just depressed, they're in their homes, they can't interact with their families, they can't interact, they can't have a social life. And so these meds come along, and now all of a sudden they're dropping weight. Now, we know that some of that weight or a lot of that weight could be lean muscle. And we can preach that, but to them, the scale is getting smaller. They're fitting in clothes better. They're happier. They're doing this. They're doing that. Whereas before they didn't. The the problem is we have to keep up with that lean muscle so they're not just skinny fat. You know what I'm saying? And so when a patient comes in to see us, every now and then I get a patient that wants a tummy tuck, for example, but they don't have a lot of that subcutaneous fat. It's all visceral fat. And so they're like, I really want to be smaller. I want liposuction. And you have to explain to them, here, this is the external fat you have. It's a pinch layer. Everything you have is really underneath your abdominal muscles. We can't address that. You have to do some work. You have to sprint. You have to watch your diet. You have to do the X, Y, Z. Now, other people have very minimal visceral fat. They've lost a lot of weight, and we use a term in plastic surgery, they come in deflated, which is actually for like a tummy tuck a great thing. It's only skin. They've deflated all the adipose or the fatty tissue, and then we can really contour them and give them that aesthetic result that matches their new mental well-being. Because there's a disconnect often. These patients feel better. They look better in clothes, but when they take their clothes off and they look at themselves, they're unhappy because they want to feel and look a certain way, and they deserve to. And so when they come to us, we're trying to figure out if their one is their mind in the right place, and two, if their body's in the right place. Because if you do an abdominoplasty, a tummy tuck on somebody that is deflated, and they still look like thick, you've really not done them a service. And I think talking to the patient, understanding, and this whether it's hand surgery, trauma surgery, craniofacial surgery, or aesthetic surgery, you have to understand the goals of the patient. If they say, I've been working out for 3 years, I'm on semaglutide, and I've lost 75 pounds, but I just can't get rid of this skin. That's a patient that's an ideal candidate. They understand their problem. As long as they don't have other medical problems, you can take them to the operating room. You can contour them, resect the skin, give them a nice incision, maybe add liposuction for stubborn areas, and they're going to be happy versus somebody who comes in and is just like, listen, I have a poor diet, I smoke, I want liposuction because I heard liposuction just gets rid of fat.
Yeah.
And that happens all the time. And you're explaining to them, well, that's not the way it works. You have to understand that the fat can come back. It can come back in weird places, especially if you're not disciplined. If your mind isn't there, you'll be happy for a couple of weeks, maybe a few months, but then if you continue the ways, it's just like anything else. I could tell you're a disciplined guy. You work out. I'm sure that you have a time every day that you go and you hit the gym. In the same way, once you have some of these procedures, you have to continue the lifestyle. Otherwise, you'll fall back into old habits. And so, when a patient comes in, it's an individual approach. If you want to, we don't sell them surgery, and we don't really point out what we think is wrong because what we think is wrong may not be what's bothering them. They have to point out, hey, all of this abdominal skin, all this excess skin on my arms, all of this thigh skin, it's getting in the way. Do you think I'm ready? And personally, I like it when patients are deflated. Like I said before, you can just grab their skin and you can almost like just draw out where the cuts will be versus you grab it and it's still thick. It's a different outcome aesthetically.
I wanted to interrupt for a quick second and tell you guys about the free weight loss plateau busting guide that you can get. I'll link to it in my description, guys. I break down the exact steps of what you need to solve that dreaded weight loss plateau and, more importantly, how to prevent it. Now back to the show. Yeah, that's a very deep understanding, and I think that makes a lot of sense. The quick fix is unfortunately never good for anybody, and it sounds like with the lipo, I've heard that too, that you were saying that if they don't make those changes and they return to that normal lifestyle, now they gain it, and there's a possibility of it going to different areas. So you've seen people that have had that happen.
Oh yeah, I mean, there's a lot of, and that's part of the reason why we really emphasize board certified, and we're double board certified, and that's an important thing because there's chop shops out there in throughout the country, and you know, medical tourism in other countries that'll just give them the money, they have a nice place to stay, they're not necessarily board certified. They may not even be plastic surgeons, but they're cheaper. And so you undergo these procedures like liposuction. Liposuction used to be the most dangerous procedure in plastic surgery. Now it's actually
Wow.
Brazilian butt lift, but there's reasons for that because not all the people doing it are board certified plastic surgeons, right? And so we're trained for years and years and years how to avoid, you know, no fly zones, how to avoid organs, and how to avoid vessels. And to us, when we're doing it, we're natural. We could talk, we can do, but we know where everything is. I mean, some of the stuff that we see is so egregious, we feel bad for these patients. They come in secondary, tertiary for another consult, and sometimes we're like, we can't help you. Or we get called emergently in the emergency room because somebody's septic because they've had some kind of procedure like liposuction, not in a sterile environment, or they hit an organ, or they are not being followed up because it's a chop shop and they want you in and out. And so it's a sad state of affairs for patients because you don't know who's good or not because you're looking at billboards or magazines, but it's really the people that work in the operating room, the people that work in the hospital, the doctors, they're the ones who know who the real deal are. So I think that if you are going to have procedures done, definitely do your research, definitely talk to people within the medical field because it's your body. And ultimately, we're not in the business of selling surgeries. We're in the business of having an approach, a conversation about how we could potentially help you and just put it on the table. And it's the information is there. You can go get a first, second, third, fourth, fifth consult, put all that information together and pick what you like. And so I think you just have to be really careful about just coming in thinking that one thing will make it all better. Like you've seen the guy who does bicep curls at the gym and only bicep curls, right? Or the guy that, just runs all day. None of those things
Yeah.
work. You have to have that holistic approach. And I like that you say that because, as much of a scientist, as much of a researcher I've been and all these years of training, I'm South Indian. And in our roots is Ayurvedic medicine. And I read a lot about it. I'm very in tune with the holistic approach. When I have patients that have a bad attitude or they're just like down, sometimes I'll give them a book to read to get their mind off of the surgery they had, or sometimes I'll just tell them, listen, you've had the surgical part, you've had the scientific part, but I believe 50 to 60 to 70% of this can be mental too. If you have a poor attitude about things, that also secretes hormones and causes
Oh,
healing
yeah.
potential to be decreased. Yeah. And so I tell them that, and they're surprised that somebody like me, that's most specialized, that's doing all this stuff, is talking to them about this emotional intelligence and, feelings and about how to approach life. And sometimes patients will get a pep talk from me, and that can be all the difference in an outcome.
That's so refreshing to hear. Because yeah, you like you said, unfortunately, the side effect of getting so much more extensive allopathic training is that, I mean, when do you have time to have holistic roots, right? Like it's,
That's right.
so that's really awesome, man. And, that's really, obviously, I'm a doctor of chiropractic, and the it's I always have so much more respect for allopathic practitioners that can appreciate that, because you didn't get it in your training, or very little, right? And unfortunately, I'm in the understanding that there's almost motivation to shy you guys away from that concept. And whether you're a chiropractor, whether you're an acupuncturist, whether you're a naturopath, the same concept between all of us is like, look, there's this universal intelligence that exists in the body, and it's a very intelligent design, and it is trying to maximize its own potential. It is trying to maintain health, and it will, to the best of its abilities, with various interferences. And that's where the different philosophies come into play, with an acupuncturist versus a DC versus a naturopath versus an Ayurvedic practitioner. But they all kind of have that rooted philosophy, behind whatever it is they're doing. So that's really, really awesome. I actually didn't even know that that's sort of, some philosophies that you operate off of. That's freaking awesome, man.
Yeah, I mean, I think that, just looking back on med school, and I'm somebody that really appreciates everyone who's helped me out. And I think that my guidance counselor who helped me apply to that program that got me into Siena College, into Albany Med, and helped set this path, and all these different people have really helped me. So I, I, med school was very hard, but looking back on it, it's pretty archaic. I mean, we had 2 days of nutrition every rotation. So that means like every 3 months, we had 2 days to learn about nutrition. And we had no training in some of these holistic things, which is funny because now I get up at 4:30, 4:45. I have a gym downstairs. First thing I do is I think about gratitude. I think about my blessings. I hit the gym. I do a sprint workout often, and then I lift weights very different than the way I lifted in college, right? Just bang them out, right? Just as many as you can. Now it's eccentric. It's everything is timed. I'm really trying to do a maximum tension. And then after that, what do? I go and I meditate. We have an infrared sauna. I sit in the sauna for about 15, 20 minutes. I read Stoicism or Taoism. And these are all philosophies that I really resonate with and I feel have changed the way I approach life. I try to think about how to not be reactive and try not to let the day get out of hand. I come up with some mantra for the day. I mean, I have like little cards that of stoicism that's sitting here. It is not death that a man should fear, but he should fear never beginning to live. And I think about these things, and that's so different than my training, right? My training was brute force,
Yeah,
like
I can
memorize
imagine.
this, memorize, do this surgery, do that. And it's only until after that I figured out, there's more to health than just medicine and surgery, like cold plunge and sauna and fasting and just so many things that I've incorporated into my life that I have just changed the way this machine works and just how I can interact with others in a more just pleasant and fulfilling way. And I think that that really is hard to find um, in doctors. And so a lot of my friends, they're artists, they're musicians, they run weird companies like, I fly fish, so I have a lot of fly fishing friends that are guides. And I get the most inspiration from them versus other docs because I feel like docs are so one dimensional now and it's nothing against them. It's the way that the
It's the
systems are
whole
set up.
system. Yep.
See a patient in 3 minutes. And that's kind of why I really like how you approach it. I mean, you do things that I'm jealous of. You're walking outside, being active, talking about things, and being vulnerable, talking about your personal stuff, and that's beautiful to me because that's a way that people can really understand that we're surgeons, we're docs, we're this, we're that. You got the certificates in the back, but you're also a person, and you have feelings, and you have emotions, and you also have these underlying strings that you're trying to pull and trying to make work in this kind of confines of medicine.
Yeah. Yeah, no, that's awesome. I definitely looking forward to us actually just hanging out on a personal level, and then I'm sure we'll do.
Yeah,
I'm
dude,
sure. I'm sure
absolutely,
we'll do
man.
some more
I
episodes.
saw I saw what you did right there. You flexed the buys, man. I saw what you did. Yeah, yeah.
Oh man,
Trying to do which way is the beach,
I think it's
right?
that way, bro.
Yeah, yeah. No, man, that's good. No, I mean, I'm glad. See, that's the beauty of it. Like, we just kind of exchange some messages, and I could just tell from your thing that you're outside of what you do. You're a cool guy, and like, I really think that we could get a coffee and just talk about just nonsense for a while too.
I do. No, I do.
Yeah.
Let's give these viewers on this podcast here finish up on
Yeah.
so we were talking about different categories of loose skin, and this kind of relates to my story too, right? So I lost 100 pounds when I was 16, and
Wow. Congrats, man.
now man, it changed my life. I mean and this is a
Yeah,
typical
dude.
story, right? Changed my life. I was the most insecure person you could possibly imagine. And, I wanted to be the confident person, but I just, for whatever reason, chose to, make the weight the reason why I couldn't do it. Just a very negative approach towards it.
Yeah.
But as much as it was negative, I kind of feel like that's what allowed me to kick ass and finally fix it. So I don't know. I mean, maybe it was a good thing because, I saw a lot of my overweight friends or not my friends, but people I knew from high school that are still overweight. And, it's just interesting. So I'm fortunate that I was able to make that change, lost 100 pounds. But here's what happened for me. I struggled to keep it off. And so I never gained the entire 100 back, but I went through this vicious annual cycle where I went back and forth probably 30 to 50 pounds every single year. And it was this an attempt to, summer's coming around the corner, gotta look good, with the shirt off. And so I'd go hardcore, right? Because this was before fasting. This was before
Hmm.
the old school method, which is just, calories, reduction of calories, 6 meals a day, cardiovascular, weight training. And so it worked on the short term, but it's not sustainable, And
Yeah.
so I wanted to kind of like share that and then relate that to another topic of, is that why, even though I lost my loose skin or I lost my weight so young, you would think the elasticity would have been so great. But I'm wondering, I've always thought 5 to 8 years of going back and forth, that yo-yoing, that's got to play a huge factor, right? In the elastic potential, and almost like kind of hits an end point where the skin's like, that's it, I'm done. You've asked me too much to go back and forth.
Yeah, I mean number one, congrats, man. I don't know how old you are, but I'm sure this was a time where it was challenging to be 100 pounds overweight. I mean, it's always challenging to, whether it's now or like 70s and 80s and 90s, but I know how that felt because it's a tough time. And I mean, when you think about it, it's it's so hard to not put weight on in America, right?
Oh,
So when I
right.
was in med school, my roommate and I, we lived next to a McDonald's, and we made a pact we would not go to the McDonald's ever, only one time per semester. And there were like 3 semesters, and we would go all out. And I mean, I look, and cheeseburgers were 39 cents. So who's going to go and get, you know, quinoa at Whole Foods when cheeseburgers are 39 cents? So we would once every semester spend like 30, imagine this, $30 per person, and we'd go into a coma, feel sick, and it would just wipe you out, right, for the next semester. But the yo-yo dieting, definitely, I mean, literature supports it, histology supports it, that it does affect the way the skin can recoil. And so it's hard because, I mean, I know what that's like. I mean, I haven't lost 100 pounds, but I've lost between 20 to 30 pounds. And, fortunately, my skin recoiled, but I could see that summer's coming, right? You want to get more lean, but it gets tougher. Like, it's tougher for me now I'm 45, for me to lose weight because uh, I think part of it is our lifestyle. I mean, there's always, as much as I read about Stoicism and Marcus Aurelius and all that stuff, I still don't have balance. I'm I have 2 young kids, 5 and 3-year-old boys, uh, an amazing marriage, an amazing wife, but I also have a demanding job, 2 practices, and just like everybody else, we're trying to get through the day. And so I think that it's hard to not get caught up in easy meals and not get caught up in processed foods and the especially in medicine, everyone's got donuts hanging out, somebody's birthday, to you don't want to offend people. It's hard to do that. And so I think it's really challenging to avoid yo-yo dieting. And I think, again, back to the mental, right? If you're just taking, you know, these medications and you're like, you know what, this is going to be my magic bullet,
Right.
and you get sick, or you're like, you know what, I'm going to decrease the dose and I'm just going to, see how it is, and you gain weight, and well, I'm gaining weight, let me increase the dose. That's what's going to happen. We're going to see a whole new population of people that haven't mentally prepared for this weight loss and are going to have these yo-yo cycles, and their skin and their um, just body can't cope with the yo-yo dieting. And I think that either, they'll come in for resections of loose skin, or they'll just be unhappy. And so I think that what you're saying is a definite thing that's true. I mean, that's why they talk about avoiding that rapid loss of weight. I mean, anywhere, more than 1.5 pounds or something, like 1 to 1.5.
Yeah.
You don't want to do that because part of it, there's a health aspect, but from plastic surgical perspectives, the elasticity of the skin, the recoil of the skin, the glycosaminoglycans, all this like kind of nerdy stuff we learned in med school, that gets affected.
Yeah.
And we just don't have a real good answer for that. I
Yeah.
mean, there's things that we do, like there's plastic surgical treatments, non-surgical that we do that can help tighten collagen, and it's kind of interesting, right? The collagen and the dermis, a lot of the loose skin is due to dermal just thinness and stretching and loss of the structure of it. But some of these techniques, like for example laser, we laser people's faces. I do it for burn patients, I do it for aesthetic patients. What it does is it causes controlled chaos. It infiltrates into the dermis, it breaks up the collagen that was in a random pattern, and it forms injury, but in a controlled fashion. So what is the side benefit of it? It tightens skin. And we use ultrasound for that. We use broadband light. We do certain injections can help PRP, for example, and we can do just some fillers do that. And we just have a good armamentarium about helping, but ultimately, it's getting back to that philosophical kind of understanding of where you are. Are you willing to go the extra mile and understand what's happening and not just be a passive passenger, right? You want to
Right.
be active and say, I personally think that some of these medications at a super low dose are, there's literature behind improving cardiac function, improving longevity. And I think that people that are interested in lifespan are going to start, I mean, I may start doing it not for weight loss, but for improving other aspects of health. And that's just coming out into the light right now.
Yeah, that opens up a whole nother can of worms.
Yeah, man.
Obviously, I'm against the long-term use of the medications, but you're talking about a whole different concept. You're talking about
Sure.
very small dosing.
That's
And
very
so,
microdosing them. Yeah.
yeah, yeah. If we're talking terzepatide and we're talking, 1.5, 2 milligrams, that's definitely a low dose for sure.
Yeah.
And
I'm even talking about like point 0.5 to point 0.8.
oh, even lower than
That's
that.
what
Oh,
I'm
yeah, that
even lower. Yeah.
yeah, yeah, that's interesting for sure. I'm definitely keeping my eyes open for what sort of advancements come out in the literature with regards to that. Um, I know we're running out of time. I know probably the next episode I want to take a deeper dive into all the various procedures that you do so I can let everybody know.
Amazing. Yeah.
I think the lasers sound awesome. My girlfriend just did some
Yeah.
freaking, so just
Hmm.
real quick, what's the technology on the laser? Because she just did one not too long ago. It's supposed to be the strongest for aesthetic for the face. I wonder if it's the same one.
Sure. Well, I mean, the company we have is a Cyton laser. Fortunately, us four, we were able to come together, put a lot of capital into our practice, and we wanted the best for everything. We want to take care of patients like, again, like they're our family. And so we got the best laser, we got the best 3D imaging for face, for body. We have ultrasound. We have two operating rooms. I mean, you're gonna come and I'm gonna tour it,
Oh,
and
I'm
we're
gonna
gonna have
come. I'm coming for
some
sure.
coffee
Yeah,
and
yeah,
just
yeah.
chill.
I'm
Yeah,
I'm
yeah.
coming by.
But the way the laser works, it has to do with, actually, when it comes down to it, it's damaging. When you cause damage, it's just like the guy doing bicep curls, right? He's damaging his
Micro
biceps.
damage.
Why? Micro damage causes hypertrophy. In a similar fashion, when you injure the collagen, but not all of it, in certain areas, it causes it to scar up and tighten, and it gives some impression of tighter skin. And it actually can not just give impression, but it can also change physiologically that collagen such that it's improved. And so we do things like, we have a machine called SoftWave, which it sends off ultrasound into the. We do it for neck. When we have a little neck fat here, we can do that. We do light. We do. I mean, there's so many cool technologies. But yeah, for my burn patients, I do laser to help. Some of these skin grafts we put on can limit function around mouth, around joints, around hand, and the laser causes that controlled chaos, softens up the scar, allows for mobility, decreases itchiness, decreases pain. And that's the recon side. From the aesthetic side, things like PRP, we inject that into joints, we inject that into the scalp, and we inject it to the eyelids, into the face for rejuvenations, these vampire facials, things like that. But yeah, I mean, it's an exciting. I love what I do, and I can tell you love what you do. because it's exciting. I get to use uh, the trifecta of art, sports, music into how I approach surgery. I mean, I think that uh, just looking at a patient, looking at their face, looking at their body, and trying to solve the problem with the modalities we have is a challenge, and it's exciting, and it allows us to just kind of help people in a way that that some people don't really understand, that unless you're going through it, right? If you have a nose that bothers you and it keeps you in the house all day and you're not able to interact, to some person it just may seem vain to do a rhinoplasty. And we've done rhinoplasties on patients that come back crying because this is the first time they were able to go outside. The same way excess skin or a prominent mole or some kind of scar that reminds them of a trauma. I mean, it's all aesthetic surgery, but I think I in my mind I think of it as functional because it's functional for quality of life.
Yeah. Yeah, no, that I 100% agree. Oh man, yeah, I see the topics coming for sure, and I know we're out of time right now, but I'm definitely looking forward to the next one, my man.
Yeah, man, dude, this was amazing, and I really want to give you props because it's not easy to do what you're doing. I'm still a fledgling in Instagram and social media and trying to do my thing and learning it, but the way you do it, you put on really, like when a post of yours comes up, I'm watching it and I'm just like, man, this guy's figured it out. I mean, you speak really well. You're a good looking dude, and you have a knowledge base that's really not just going to help people, but you're going to save lives, dude.
I appreciate that. That means a lot coming from you, and yeah, no, I'm looking forward to the next episode, man.
All right, brother. Thank you so much, man.
Yep.
If you guys found this informative, then you're gonna wanna click this video right there. It's a continued explanation of what you learned today, guys. Knowledge is power, so let's keep this going. We'll see you later.